Okay. Good evening, everybody. Thank you so much for joining us tonight and taking time out of your busy schedule. I know if you're like me, cancer is an important topic. I think, one of the things we asked everybody before was how you've been affected, whether it was you that had cancer, a family member, a friend, but everybody wants to prevent it and heal from it. So we're so grateful that you showed up tonight and took time out of your schedule. We are recording this, so hopefully we can share this afterwards with people that couldn't make it. My name is Karen Orlosky. I live in Cumming, Georgia, which is north of Atlanta. And I lost both of my parents to cancer. So this topic I am very passionate about, which is one of the reasons that I wanted to share this and find these amazing speakers. You guys are going to be blown away by the information. So I'm going to do a very short presentation because we want to learn more about, why. Part of what we're going to learn about is kind of why we get cancer a little bit. And so this community also, one of the things is this community has done for me is really educated me and motivated me and really made me aware of trying to prevent and trying to stay healthy and also trying to help others. So we are here to inspire healthy living. And okay, so this first slide I saw about 18 years ago when I saw a presentation from somebody in this company. And it really was like somebody punching me in the stomach because I happened to be pregnant at the time. So this really hit me hard. And if it doesn't for you, then I would be surprised. And this is the statistics. The cancer is just rising. So Americans, we are unhealthy. While heart disease is the #1 killer, we're focusing on cancer tonight. And there are, a lot of diseases out there, but cancer, I think, is one that really tends to scare people because you feel fine one day and then you're diagnosed the next day. So the sad truth is that cancer cases and deaths are still rising. We see all the time. I just had a friend today text me, please support me. I'm walking for my sister that has breast cancer. So American Cancer Society, American Institute of Cancer Research, there's all these organizations, but cancer is still on the rise. The good news is that researchers, the medical community is also learning about fruits and vegetables and the power of plant nutrition. So they're prescribing fruits and veggies and learning that it's just going to save, $1 billion in medical costs. So trying to prevent instead of treating is going to just save everybody so much money. So after looking at this slide, who would rather eat broccoli? Okay, I would rather eat 1 to 2 pounds of broccoli a week than have to go on the drug tamoxifen. I think that's a powerful slide. So you can see a theme here. Let's focus on fruits and veggies. This is an old slide that I found. Some of these are a little old, but I love this because this is from the American Cancer Society. And what's the theme of this? Reduce your risk of cancer. And what are they pictures of? All fruits and vegetables. So that to me is just so powerful too, the message of fruits and vegetables. So one of the things I find when I talk to people is they are surprised at how many servings of fruits and vegetables that we need every single day. Most people think that we still are at that 5 to 9, and we really need 7 to 13 servings of fruits and vegetables every day. And there's so many reasons why athletes need to eat even more. And if you have cancer or you have heart disease, you need to eat even more than that as well. Experts say you need to be probably eating about 20 servings of fruits and vegetables a day, which I know would be, you'd have to quit your job and be a stay-at-home vegetarian. So multivitamins versus food. For the last 70 years, we have thought we've been told the answer is a vitamin. We don't eat right, so take a vitamin because that's gonna help bridge the gap for you. We know we're not eating enough fruits and vegetables, just take a vitamin, you'll be fine. And that's not the answer. Research is actually showing now that isolated vitamins may do more harm than good. And it doesn't even come close to replacing the nutrition in the plants, in the food. So if you can see the picture on the left, the supplement facts, maybe it's got 20 or 30 different ingredients. An apple alone has 10,000 phytonutrients. So it can't even, you can't even compare it. Your body understands the nutrition from the fruits and the vegetables. It doesn't understand so much the nutrition, from isolated synthetic vitamins. So how do we bridge that gap if vitamins aren't going to work? One of the things that we have found is some plant nutrition. It is a whole food concentrate called Juice Plus. And it is the easiest way that I have found to kind of bridge the gap between what I've been eating and what I'm supposed to eat every single day. While we do pretty good, I don't do perfect every single day. And this is one of the commonalities that all of the speakers today are going to be talking about as well, is how this plant nutrition has helped them, not just in daily life, but has helped them through their, cancer stories and their cancer journey. So what is Juice Plus? Juice Plus, if you look at those, it's nutrition from over 30 different fruits, veggies, and berries. And we also have the plant-based omegas. So imagine in a ginormous salad bar and taking all those fruits and vegetables and fitting them into capsules. And that's exactly what it is. There's a lot of people that, we eat fruits and vegetables every single day, but we're not eating enough and we're not eating a huge rainbow. We're supposed to be eating a huge variety of fruits and vegetables. And if you're like my family, we tend to eat the same fruits and vegetables all the time. So it's really difficult to get that variety in there. So the Juice Plus Complete, I want to introduce my friend Lydia to talk about the Complete and to also share her story.
Thank you so much, Karen. So one of the products that we're really proud about is our Juice Plus Complete Shakes. It's vegan, gluten-free, dairy-free, and it's sourced from protein from beans and peas and non-GMO soy. And it's full of superfoods like broccoli sprouts, radish sprouts, alfalfa sprouts. And if you remember that slide with the broccoli and giving us the benefits of tamoxifen, well, broccoli sprouts have up to 100 times the power of the broccoli plant itself. So can you imagine getting that? We get that in our shakes every single day, those broccoli sprouts and those same benefits. And a few years back, I was teaching a cooking class for Physicians Committee for Responsible Medicine. And that's when I really learned the benefit of non-GMO soy and also antioxidants and phytonutrients. And MD Anderson Cancer Center, which is one of the top cancer institutes in the world, actually did a study using our Juice Plus Complete Shakes and our capsules on women with ovarian cancer. And proven that it helped improve their outcomes. It improves their nutrition, it improves their cellular health. And that's going to help people get through their treatment and also their recovery. Your cellular health makes a big difference as to how your treatment goes for you. About 7 months ago, I was diagnosed with HER2 positive breast cancer, which resulted in a surgery. And when you're first diagnosed with a disease, well, first of all, it's your body sending you kind of a wake-up call. It's sending you messages that things need to get kind of back under control. And at first you feel like a victim, especially with cancer, and that's normal. But then after that, you can use that for your own power. At some point, you need to take ownership of what's happening as far as your disease. We all have like this team of people. We have our oncologists, we have our surgeons, but you need to be part of that team. You need to do your part. And it's empowering, but it also, you kind of take control of your health. And that helped me to improve my outcome. But I was so grateful that I had the Juice Plus products. It's part of my arsenal because I can't get 10 to 15 servings of fruits and vegetables every day consistently. And when you can add those things to what you're already doing as far as your diet and your lifestyle, all those changes that you're making, it kind of compounds your efforts and it's going to improve your outcome. As a nutritionist, I've never believed in multivitamins. And when I was introduced to Juice Plus, it made sense to me because it's concentrated food. When you do any kind of research on some of the top foods to help prevent cancer, you're going to find things like dark leafy greens. That's like number one. Berries, allium vegetables like garlic, citrus fruits, beans, and we get all of those things in our Juice Plus every day. So Thanks to get home. And if you have any questions, please feel free to reach out.
Okay, Lydia, thank you. Oh my goodness. Okay, so I have been drinking these shakes for I think almost the whole time, the 18 years, and I drink them for breakfast every single morning and love them. My daughter drinks them. It's a great way to refuel after, before and after workouts also. Okay, let me. So Juice Plus is unique. Why Juice Plus? It's plant powders. Instead of being isolated synthetic vitamins, it has a food label. Excuse me, it's not a multivitamin. It's NSF certified, which is the National Sanitation Foundation. And so they test different batches of the powders to make sure, honestly, that it's just safe for human consumption. We also have the NSF sports certification for professional athletes, Olympians, things like that, which is very impressive. We also just got in, I'm going to throw this in there, we also just got into the United States. Well, I guess the complete shakes have been in, but maybe the capsules just got into the United States Performance Center in Charlotte, North Carolina for like the Olympians training. And then it's the most researched whole food nutritional product in the world with over 40 clinical research studies, which we're going to be talking about. And that is one of the things that impressed my parents. So I'm going to share just a quick story. My mom, both of my parents passed away from cancer. My mom had AML, which is acute myeloid leukemia. And when she was diagnosed, her oncologist, because it was terminal, I think her oncologist was like, oh yeah, you can take that Juice Plus, that's fine. But she wanted to get a second opinion. And so we went to the Mayo Clinic. They were living in St. Augustine and there's a Mayo Clinic in Jacksonville. So we went to the Mayo Clinic and they gave quite a screening. And they took for about an hour. They asked her all different kinds of questions. I mean, what are you taking? What are you doing? What are you eating? Just everything. And when they asked what kind of supplements are you taking, what kind of medications, and she said Juice Plus, the woman looked at her and she said, I'm so glad that you're taking Juice Plus. She said, we aren't allowed to share it. She said, but it can help you nutritionally through your, through your procedure and through your fight with cancer. So it was just so great for us to hear that, because while I had such a belief in Juice Plus, it grew even more hearing that from the nurse at the Mayo Clinic. Okay, so Juice Plus is not about treating or curing specific conditions or diseases. Juice Plus is simply fruits and vegetables. And while fruits and vegetables are powerful, everybody's body is different. We can't, make any claims like that. Okay, I am going to now pass it over to Dr. Joseph Pohl, who has been a practicing physician for over 40 years. He's an OBGYN, and I just love listening to him. He's going to talk about the research.
So as a physician with almost 40 years of experience, it is really the research, the quality and the quantity, really the depth and breadth of the research that really compelled me to start using Juice Plus for myself and my family several years ago. And now I recommend to my patients. And I love, and I wholeheartedly agree with Dr. Du Bois's statement at the bottom of that slide, where he says there is nothing else available any place in the world with or without a prescription that has been clinically proven to do what Juice Plus has been proven to do. And that's why so many doctors have joined the Juice Plus family. Now, there's a lot of amazing things that 47 studies have shown. And I just want to highlight a few of these that are most pertinent to our cancer conversation that we're having tonight. First and foremost, the research of Juice Plus wants to make sure that it's bioavailable, that it actually gets into your bloodstream. So that's amazing. And it wants to make sure it's bioefficacious. And what do we mean by that? It's not disease specific. We follow biomarkers. And the beauty of that, it makes it universally applicable to many diseases and many conditions. So let me give you a few examples. We have about 14 studies showing how it reduces oxidative stress. And just remember that most cancers begin with mutated cells. And those mutated cells come from damage of free radicals. And we want to reduce that free radical damage. And the way we do that is with antioxidants and reducing oxidative stress. So we got 14 studies showing how Juice Plus reduces oxidative stress. 4 studies showing how it supports the immune system. Remember, the immune system isn't there just to fight a cold or the flu. It's there to neutralize those mutated cells. We need a good functioning immune system to fight off cancer. And so we have 4 studies showing how natural killer T cells are supported better with Juice Plus. Inflammation, it's the root cause of most of our problems and certainly can be part of the Juice Plus problem as well. We got several studies showing how Juice Plus reduces chronic inflammation. We got a study done at MD Anderson, which is probably the world, it's not just the United States, but the world's premier cancer research institution. And they did a study in ovarian cancer patients showing how Juice Plus supports their quality of life. And finally, we recently have some studies showing how it supports the gut microbiome. Remember, the health of the gut, not having leaky gut, because the immune system is within 1 to 2 millimeters of our gut lining. We want to make sure that that gut lining is not breached. And Juice Plus now has research showing how it supports the gut microbiome, reduces this leaky gut phenomenon, and would be amazing for people to be on to reduce their risk of getting cancer in the first place.
I love that. Thank you. So yeah, I wasn't smart enough to really understand all of that research in the beginning. For me, it was just, oh my gosh, I don't get enough fruits and vegetables. So it just seemed simple. Okay. So I love this because this is a list of a partial, like it's a most list of the leading hospitals and universities that Juice Plus has been, the research is done at. And I heard a doctor speak one time and he said, you're known by the company you keep. And if we look at this list, that's pretty darn good company, I would say. I mean, and just like Dr. Pohl said, MD Anderson Cancer Institute, you know, all of my Florida friends, University of Florida. So it's pretty impressive. Okay, so now I'm going to turn it over to Rhonda Brown, who has been, oh my gosh, a pharmacist for over 40 years. And she has a personal story and is living proof of this study, which I love.
Well, thank you, Karen and Amy. Yes, first, I just want to say as a pharmacist, the only reason I ever added Juice Plus to my diet was because it was backed by research. My mom died at an early age from Alzheimer's, and having diabetes in my family's history, I wanted to learn more to help myself be healthier, because when I looked at my health picture, it scared me. I'd always exercised and thought I was healthy. I didn't learn till later in life that food played a major part of being healthy. So tonight, I'm going to share this study that is now near and dear to my heart. It's the ovarian cancer study published in Gynecologic Oncology and was done at the University of Texas MD Anderson Cancer Center. Now, this study was really about the quality of life of ovarian cancer survivors, and they did it with this group because ovarian cancer survivors have a low life expectancy, as we all know. They took 2 groups of women, and in one group, they had the women eat 10 servings of fruits and vegetables daily. The second group ate 5 servings and added the Juice Plus fruit vegetable capsules and added the Juice Plus Complete. And after 6 months, they found that both had increased key antioxidants, and Dr. Pohl talked about that. And they also had stabilized key markers of cancer, and they had improved cell health. That means the cells were getting healthier. The Juice Plus group had a better protein status, and this is huge because, as you know, cancer patients don't want to eat, or even after you're done with chemo, you don't have an appetite. And so cancer patients can die due to protein loss because you can't maintain organ tissue or muscle mass if you're not eating good protein. So when I said I was afraid of my health picture, cancer wasn't anywhere in my radar. However, in January 2015, I was diagnosed with ovarian and endometrial cancer, And the doctor said I was going to have to do radiation and chemo, and I really didn't want to do that. I had studied chemo and it wasn't one thing I was looking forward to. But the doctor said, Rhonda, I never say this about ovarian cancer patients, but if you go ahead and do this radiation and chemo, and I can't even explain it, I believe you'll be done with this. So I did it, of course, and I added the Juice Plus capsules to my diet years ago, but I had never added the complete until then. When the nutritionist came in and brought me a bottle of Boost and said, you're going to have to drink this to get a lot of protein while you're going through this, I was so grateful that I had learned enough that I knew I wasn't going to do that. And I told him I had a better protein source that had a lot more nutritional value, and that was the Juice Plus Complete. So during radiation and chemo, I ate clean, rested, had plenty of water, and ate as much Juice Plus as I could. And I had 2 complete shakes a day. The omegas weren't out then, or I would have added those too. So during radiation, the doctor said I was going to burn, be tired. I was going to have diarrhea and bladder problems because of the area I was being radiated. But when it was over, I realized I was never tired. I never burned. I never had diarrhea, and I only had a few bouts of bladder urgency. Then with chemo, I was the only one sitting up in my chair, looking at my iPad, had energy that no one else did, never got sick, never had to delay a chemo because of my numbers, never got the neuropathy that I was so afraid of. And not only that, halfway through chemo, the nurse practitioner came in and asked me, said, Rhonda, are you back at work? And I said, no. And she said, well, you can go back to work. And I said, well, did you forget where I work? I'm a retail pharmacist, sick people, flu season. She goes, yes, I know, but Rhonda, we can hardly tell by your blood work that you're having chemo. So I am living proof of this study. I know my outcome would have been totally different without Juice Plus. The hope and peace of mind that is given me is priceless. Thank you.
Oh my gosh, I got chills listening to your story. I mean, that's amazing.
Thank you.
Oh gosh, thank you. Thank you guys for
Glad to be here.
Okay, so kids need nutrition, true. I think that my kids used to eat so healthy, and now I joke around, my son has gone to the dark side. He's 18 and he eats everything that I don't want him to eat. I kept away from him. So ask the person who invited you on tonight, because we have a family health study where if you have a child between the ages of 4 through undergrad and college, they can actually get Juice Plus for free with a sponsoring adult. But even if they aren't that age, they can eat the gummies, they can eat the capsules. It's completely safe. So I want to share, before we go to a few more stories, some resources for you guys. Because again, like I told you, my mom and dad had cancer, so I've done a lot of research with this. You can screenshot this if you want. There's some books to read: the China Study, Eat to Live. The websites, Cancer Project, nutritionfacts.org is a great one. Dr. Michael Greger, you can go in there and actually just do a search for any disease and all kinds of information. And then the nonprofits for support and education, beatcancer.org is Dr. Susan Silberstein. And she, well, she's got an incredible story. I don't have time to get into that, but she has a great website, and they also are a nonprofit where if you need help, you need a consultation, they do that over the phone, but they also have a website where you can order books and other kinds of education. And then Healing Strong is actually a nonprofit that was started in Gainesville, Georgia. I have met the founder of that, and she is incredible. And this is across the country. So they used to meet in person, but now it's on Zoom. So if you know anybody that wants to learn, how to support their health with cancer and other diseases, have them go onto that website and find, it doesn't even have to be a chapter close to them, because they can join a Zoom. So, okay. I hope everybody got a shot at that. Let me stop sharing my screen. And I want to now, I'm trying to think, we're going to go to Kris. We're going to go in alphabetical order. So Kris, I would love for you to share your story.
Okay. Well, thank you so much, everybody, for getting on this call tonight. I was just 34 years old when I was diagnosed with an aggressive form of breast cancer. a young, active stay-at-home mom of 2 little girls, I really thought I was healthy. And so this diagnosis came as a complete shock, especially since I had no significant family history of the disease. I did everything my doctors offered: bilateral mastectomies, 6 months of chemo, and the removal of my ovaries, followed by years of hormone therapy. But I also asked the doctors that I met, what should I do differently to help avoid more cancer? The answer was always the same: this was just bad luck, and we got it, so you're fine now. I was eager to get back to a normal life, so the notion that I didn't need to make any changes to my diet or lifestyle sounded great. But thank God a wise friend told me about one simple thing I could do: swallow some plant powders every day in capsule form. That advice made sense to me and required little effort, so I immediately began my journey with Juice Plus in November 2005. Fast forward almost 4 years, I was back in the operating room for a breast reconstructive surgery when my surgeons found many bulging, discolored lymph nodes in my armpit that were full of cancer. They removed all that they could find and woke me up to the news that I was in serious trouble and needed to see my oncologist ASAP. I'm certain they believed, based on what they had just seen, as well as their knowledge of how cancer quickly spreads once it's in the lymphatic system, that this cancer would have metastasized. To everyone's dismay, it hadn't. I needed to go through chemo again and radiation the second time around, but the fear that it was back, along with the news that it wasn't behaving like the doctors expected, really got my attention. I immediately started researching the best diet to fight cancer and learned that plants are key. So this wide variety of nutrient-dense plants that I had been consuming over the past 4 years was such a blessing. Little did I know that inflammation and free radicals were decreasing, my DNA was being repaired, and my immune system was improving. Findings that the research on Juice Plus have repeatedly shown, and all things that can impact how cancer grows and spreads. But I was also learning that the amount of sugar, processed foods, and dairy that I regularly consumed, all while being a vegetarian since college, were not serving me well. So I pivoted and became a much cleaner, plant-based eater almost overnight. Finally, understanding the connection between nutrition and disease motivated me to improve what was on the end of my fork. I felt very empowered knowing my choices could in fact influence my health. I learned that the standard American diet makes our pH balance very acidic, and cancer thrives in an acidic environment. But plants make the body more alkaline and can help prevent cancer growth. So clearly the news was, the more plants, the better. Thankfully, when you consume Juice Plus, your cells, including your taste buds, go through a process called metabolic reprogramming. So things like those dark leafy greens and mushrooms that I hated as a child now tasted delicious. Therefore, eating lots more of them wasn't a hardship. I also found that adding the complete shakes to our daily routine was a game changer. 15 additional plants different from the capsules, and 1 less meal that I needed to fix. During my cancer journey, I actually traveled to MD Anderson many times, and the fact that this world-renowned cancer center studied these products and found huge benefits and no risk was all I needed to know. I'll never go a day without them, and I strongly encourage others to do the same. It's what I like to call my nutritional seatbelt. There's several additional changes I made following that second diagnosis, such as drinking more water to help flush out toxins and practicing yoga to help manage my stress. All these things add up and contribute to a better quality of life and less illness and disease. And I'm thrilled to say that I'm 52 now and the healthiest I've ever been, including remaining cancer-free since 2009.
Yay. I know, I love these stories. Okay, so we have Judy Pohl. Is Judy speaking tonight?
You start off, okay.
So here's Judy. I'm going to let her tell her story. She's from Virginia. She went to Virginia Tech. She studied accounting. She was an accountant for many years. We have 3 beautiful children. And like Kris said, being given a cancer diagnosis is a total shock always. So I'm going to let her take it from here.
Here we go. So it started with mild tumors at the end of 2016, which ended up being seizures. I had my MRI near the hospital in 2017, and they found such a large tumor in my brain. They took me immediately by hand up to the emergency room. The tumor was all on my left side, and it was very large. They took a biopsy from my brain to see what type of tumor it was. Thankfully, it was a brain tumor with 2 favorable genetic features. We had many appointments from Atlanta to North Carolina. Duke University wanted to do surgery and remove my tumor. But my thoughts about this was that I would not be able to walk again. Then we went to Dr. Michael Sutchison, a local neurosurgeon, and he did the best exam. He had me walk back and forth and count backwards from 100 by 7. His opinion was to avoid surgery for now and try chemotherapy plus radiation plus steroids. I did radiation oncology with Dr. Stillwagon. While I was in the radiation, I imagined my mom holding my hand. That was big. To have her, she had passed many years ago, and it was big to have her thoughts with me. I was taking Juice Plus for years, but not admittedly consistent. After I was diagnosed, I did not miss a day. I had a lot of fatigue during this time. My dog Toby was my support during each and every day, a lady's best friend. While I took chemo medication and steroids, I was not allowed to drive. So I rode with Joe to his office in the morning and waited there for my appointment, usually around 8 a.m. When I did not have a ride home, my tennis friends and neighbors developed a schedule to pick me up and take me back home. During my radiation therapy, one bonus was that we made it to my daughter Lauren's graduation at Ole Miss. As a reward for the 6 weeks of radiation, we went to the beach with Lauren and our dog Toby. Our son Brian came to visit, and he stayed with us for the weekend. Now, 5 years later, I'm off all medications and in full remission. I was determined to have success with this process, as I was not going to leave my husband and my children. I did everything the doctors wanted me to do. I am now back into my healthy ways of proper eating, exercise, and better sleeping. That's it.
That story never gets old. I've heard it so many times, but I just, so inspiring. Okay, we have Trina. Are you on, Trina?
I am here. Thank you so
Yay.
much. Gosh, I know that I believe I'm the last one, and these stories have been absolutely amazing to listen to all of your stories. And, you know, for me, I grew up super active. I played college soccer, and I even coached afterwards. And, you know, I thought that being fit was what being healthy was all about. And so, you know, fast food, sodas, those were part of my life. And I never thought twice about, you know, what it was I was eating. But at the age of 30, I developed a large lump on the left side of my neck. And at first I thought nothing of it, sort of my personality. I'm like, oh, it'll go away. And at the time I was actually working at a health and wellness company. And I like to joke, but it's really true that while I worked there, I wasn't living anything, nor did I understand anything that the company was about. Well, one day, one of the doctors who I work with was a coworker. He came out to my desk and he directly told me that I needed to go get this lump checked out on my neck. Now, if my memory serves me correctly, it was probably the third or fourth time that he told me. I'm a slow learner. And so I finally was like, you know what? He's telling me for a reason. And so I immediately made an appointment with the doctor. Fast forward a little bit further up, and I was actually diagnosed with Hodgkin's lymphoma, which is a blood-related cancer. And so over the next several years, I went through chemo and radiation. And as I came out of my treatment, it became clear to me that I needed to make some lifestyle changes. So I turned to my coworkers and I began to learn about the power of nutrition. And there's so much we can do for our bodies. They're absolutely amazing. And, I need to make a lot of changes. I had to get rid of that soda. I had to get rid of the fast foods and the processed foods. And there was a lot. And I started out simply. And I started with one thing and I just began to make a lot of changes. And over time, I was able to really change around what I put in my body. So when I was introduced to Juice Plus, it immediately made sense to me. And I knew that it was hard to get a lot of fruit and vegetables into my body. I knew the importance of it. And I wasn't getting the variety. There was no way, I don't think even to this day I've ever seen like an elderberry, for instance. And so I knew I needed to get more into my body. So Juice Plus made sense. And I actually joined the business right away because I had become so passionate about helping other people, because my personal mission is to help others not ever have to go through what I had already gone through. And I've been cancer-free ever since. I was back in 2004. And, I went from barely living to now thriving. And a huge part of that puzzle was, was to taking Juice Plus. I take it every single day, take all the products, and I have for 13 plus years. And, the other part of that is the healthy living community that Juice Plus has. And it's been absolutely amazing. I've learned so much. And so thank you for letting me share.
I love that. Thank you so much. Okay, so are we noticing a theme, right? It's really about plants helping to keep us healthy before, during, and after. So whether or not, okay, we have inspired you to go and eat more fruits and vegetables every single day. Try to get to your, when kids need 7 a day, women need 9, men need 13. If you are already on Juice Plus, or you can reach out to the person that invited you onto this, whether it's the recording or live, reach out and ask for more information about Juice Plus if you're not on it. Ask about the fruits, veggies, berries, and omegas. Ask about the shakes to, help support your nutrition, whether or not you have cancer, just to be healthier, and for prevention or for healing, because that's what tonight was all about. It's about being healthy, and it's about, giving you hope. So I hope you guys got hope. And then if you were so inspired for this, I hope that you decide to share Juice Plus. Even you might already be a customer and you loved some of these stories. You can go and you can tell your friends and your family about Juice Plus and share that, because we're only so many people and we can only talk to so many people. So we need other people sharing, the nutrition of Juice Plus and all about plants. So, okay, so we are going to, I have oh my gosh, everybody on here, Dr. Pohl and Rhonda Brown and Lydia, everybody on here has been so gracious to answer a few. We can do a little bit of a question and answer. So I don't know if anybody if we want to, I guess we can do this in the chat. If anybody has a specific question, if you can put it in the chat. Share the information flyer again. Melody, are you talking about the resources? I think that's what you're talking about. I can share that again if anybody didn't get a picture of that. Okay, let me take that down. Okay, so does anybody have any questions? I can't believe nobody would not have any questions. What if you're, okay, here we go. What if your doctor says no supplements? Oh my goodness, yes. Let's ask Dr. Pohl. So somebody has been diagnosed with cancer and the doctor said no supplements.
So the world of supplements includes a lot of things. It could be vitamins, it could be minerals, it could be concentrated plant powders. I mean, everything, all of that could be considered supplements. So I think instead of just lumping it all together, that's a mistake. Instead of lumping it all together and saying no supplements, you should ask questions. I was on a Zoom call with Dr. Bill Sears last night, and he said, ask questions. Ask, why not supplements? Which supplements are you talking about specifically? Now, if you're going to have surgery, there may be some supplements that may increase bleeding time. So you need to kind of respect that. There may be some things that anesthesia and the surgeon doesn't want you to use. but ours is just food. There's nothing in the Juice Plus product line that you should be told that you can't take. So again, my advice to you is ask questions, be specific about what they have problems with, but there should be no problems with Juice Plus.
Perfect. Rhonda, does anybody else have anything to add to that?
Well, I just want to say the oncologist could have told me to get off Juice Plus, but there's no way I would have. I wouldn't do it. I was just mad at myself. I hadn't started the complete earlier instead of waiting until then. But yeah, I just, it doesn't ever occur to me to tell people because it is just food. And I wouldn't have stopped it.
Okay, I'll add a little to that too. So I guess if your doctor says, you know, avoid these certain foods, like you can't have berries or you can't have fruits and vegetables, because that's basically what Juice Plus is. And we're not a supplement, we're not a concentrated form where it's going to fight against maybe what how they're treating you. So, I mean, your doctor's still going to want you to eat healthy, right? They're not going to tell you don't eat healthy. And so, but Dr. Pohl was right. I mean, ask the questions, try to get to the bottom of exactly what they mean, because it's kind of it's easy for them to just give a general blank statement rather than giving the specifics, but they're never going to tell you, no, we don't want you to eat healthy.
May I make a comment? I just finished chemo and radiation for breast cancer. And what I did was I brought the Juice Plus bottles in to show my oncologist. And when she read the labels and she said, oh, this is food. She could see from the label that it wasn't a supplement. The objection was to having concentrated supplements that fight the chemotherapy. And that would have been, I believe, if I remember correctly, they didn't want me to have a super quantities of vitamin E or C, and there was a couple of others. But when I showed them the labels on Juice Plus, she said, oh, this is just food in a capsule. So there was no objection to my taking Juice Plus. And it did make a big difference for me during my chemotherapy because I could not eat. I lost 20 pounds. I just couldn't eat. So it does make a big difference.
Oh my gosh, thank you for sharing, Melody. I love that. Yeah, I think that it's asking questions. Doctors are trying to protect us, but they just don't know sometimes. And especially if they're not familiar with Juice Plus. Okay, so I have a friend who is pregnant and her doctor told her only to take one of each of the fruit and vegetable blends because more than that would be too much of some nutrients with the prenatal that she's on. That's more of an OBGYN. It's not as much cancer related, but I'll give you 30 seconds to answer that, Dr. Pohl.
That's really bad advice. First and foremost, I don't recommend a prenatal vitamin to begin with. There's really no research on that. And the only thing that's in a prenatal vitamin, if you go to Dr. Google, the benefits of prenatal vitamin, what will pop up is folate, not folic acid, but folate is vitamin B9. And again, back to our earlier comments, this is just food. It's just food. It's concentrated plant powders. And you can take as much of it as you want. It's not going to conflict with any kind of prenatal vitamin if they insist on you taking it. I usually tell my patients or friends that have a different OB. I said, if you don't want to upset that person, go ahead and take your prenatal vitamin while you're pregnant and while you're breastfeeding. Don't ruffle any feathers, but I want you to take Juice Plus on top of that. It's just food. You cannot get toxic on food. No one will tell you, you're eating too much broccoli, you got to stop.
I love that. I tell that to people. You're never going to see on the cover of Newsweek, man dies from eating too much broccoli. Like it's just not going to happen. Okay, so what is the relationship between cancer and menopause, if there is one?
Say that
I
again.
don't know if there is one.
Where was that?
Donna, what is the relationship between cancer and menopause?
So the relationship between cancer and menopause, it's actually more of a relationship between menopause and cardiac disease, because when you women go through menopause, you lose your estrogen production. And I like to tell patients, on a scale of 0 to 100, back when you guys are reproductive age, you're making estrogen of about 50. When someone puts you on birth control pills, they raise that up to about 90 to prevent you from getting pregnant. And those birth control pills are all synthetic. When you go through menopause, that 50 goes to 0. And when someone gives you bioidentical estrogen therapy, they're giving you about 5. But the message here is that estrogen is a very, very potent antioxidant. Remember, we said earlier that cancer starts with mutated cells, mutated DNA, and and most of that damage comes from free radicals. So we want to neutralize those free radicals. We want antioxidants, lots of blueberries. And so what happens is when your estrogen level drops, you lose a potent antioxidant called estrogen. And that's why when women are in their reproductive years, their heart attack rates are very low, unless they have other risk factors like smoking. And when you go through menopause, you lose the benefit, the cardiac protective benefit of estrogen, and then your heart attack rates and strokes start mirroring that of men. As far as cancer is concerned, breast cancer is your #1 cancer. 1 out of 9, when I started medical school, is 1 out of 11. Now 1 out of 9, the number's still rising. 1 out of 9 women get breast cancer. Whether the breast cancer is premenopausal, Kris's breast cancer is premenopausal, in her 30s. It's so much more virulent and so much more deadly when you get premenopausal breast cancer versus postmenopausal breast cancer. So obviously hormones and menopause, premenopause, postmenopause has huge relevance to breast cancer and maybe other cancers, but for you women, that's going to be the most relevant one. Not to somehow minimize a postmenopausal breast cancer, but my kudos to women who've survived premenopausal breast cancer.
Okay, guys, we're not going to be able to get to all of these. There's so many questions, which I think is fantastic. I know we've got, yes, the Juice Plus protein shake is acceptable for children. It's a beautiful source of I used to give the shakes to my son every day for a snack when he went to school. Let me see what else. Can you take a multivitamin while taking Juice Plus? Who would like to answer that one? I have an answer for that, but.
I would say no. I would not take a multivitamin. There's no need to be taking a multivitamin. And for you women that are listening, there was a 20-year study looking at multivitamins in menopausal women, comparing them to a group that took no multivitamin. And guess what? The group that took no multivitamin lived 3 years longer than the group that took the multivitamin. Not only have they been shown not to be helpful, now we've got data, we've got information showing that the multivitamins are actually harmful. So get off of the multivitamin. I personally have never taken one, never will take one, never have recommended one to anyone. And my pregnant patients, I recommend them to be on Juice Plus. That would be the best prenatal vitamin, and it will lower your risk of all the things that trouble us as OBs: preeclampsia, preterm labor, preterm delivery, miscarriage, infertility, growth restriction, all the things that are idiopathic and we don't really know what causes it. I do know that Juice Plus, from Dr. Odom's research and my personal experience, that Juice Plus will reduce your risk. Again, we don't make any claims that we prevent, treat, or cure anything, but I can tell you, you would be a fool not to take it when you're pregnant.
Yeah. Okay, so we kind of did answer this. I know that Lydia went into a lot of detail about soy in the shake, relationship between soy and breast cancer.
So Dr. David Phillips explains that beautifully. And, there's 2 types of receptors on our breast. There's alpha and beta receptors. The alpha receptor is a classic estrogen receptor. The beta receptor is a phytoestrogen receptor. It's a plant receptor. And when a woman goes through breast cancer, and some of you on this Zoom call may have been put on a selective estrogen reuptake modulator or SERM drug like tamoxifen or raloxifene. That drug blocks the alpha receptor and reduces your risk of having a recurrence. Well, guess what soy does? Soy gives you a double benefit. The beta receptor, when you stimulate it through the phytoestrogens in soy, it downregulates tumor growth. And it's also been shown to block the alpha receptor like these SERM medications like tamoxifen or raloxifene. So you get a double benefit. And JAMA, Journal of American Medical Association, had a huge meta-analysis looking at soy and breast cancer. Not only does it not increase your risk, it reduces your risk, and it reduces your risk of a recurrence. So the safety of soy for women and breast cancer, and that whole discussion has been settled in the literature. So anyone that tells you anything different is not looking at the data.
Okay, so we have somebody asking about the soy for men.
So the concern there is gynecomastia. Do you get what some guys would call man boobs? And let me clarify that gynecomastia is a genetically driven problem, and there's different grades of it. And obesity is probably a bigger risk factor for getting gynecomastia than soy, because guess what? Men, our only source of estrogen is the aromatization in fatty tissue of testosterone. You women have ovaries, that's an estrogen and a testosterone factory, and in your adrenal glands, you make testosterone. Us men, we actually need estrogen. We don't need it as much as you women, but our joint health, the synovial fluid in our joints are critically dependent on estrogen. Our bone health is critically dependent on estrogen. Men can get osteoporosis as well. And it's been shown to be beneficial to your brain. So if you're very obese, you have more adipose tissue. And guess what? You probably also have low testosterone. And the little bit of testosterone that you have frequently gets overly converted to estradiol. And many times you have high estrogen levels. I'd be more worried about obesity and gynecomastia and this aromatization in fatty tissues than worrying about soy and the phytoestrogen that's in it.
Okay, thank you. I love that. So Michael, yes, I mean, I hope that answered your question. I know Juice Plus is coming out with a soy-free shake next year, but the quality of our soy, it's organic, non-genetically modified. Think of tofu, think of edamame, like it's the food. And so I kind of always make a joke that like a billion, Asian people can't be wrong, right? They're eating soy all day long. So, okay, I want to respect all, Dr. Pohl, I could sit on a Zoom and talk to you and have you answer questions for like 6
Say one more
hours.
thing about the soy, what you mentioned, that it's non-GMO. It's also water washed.
Yes,
and
water
that is
washed.
critically important that it's water washed, because some people will say, well, I have a soy-based protein shake. You have to ask them, how did that company get the protein out of the soybean? Did they use water washing, which is a little bit more expensive, but it's the way you want to do it, because if the alternative is that you use chemical extraction, and those chemicals will end up in your protein shake. And because Juice Plus is NSF certified, if it got the protein out of the soybean the way traditional manufacturers do it, it would fail NSF certification.
Yep, I love that. Okay, I know we have so many other questions, but it's almost 9 o'clock. So I want to thank everybody so much for being on tonight. The recording will be available. It's going to take some time to download it, but we will definitely get it out to all of the affiliates with Juice Plus. So if you are a guest of one of them, just ask them and we will get that to you in the next day or two. And we just want to thank everybody so much for being on today. We hope that the information helped you. We hope that it gave you hope. So thank you, everybody. Have a great night.
Thank you.
You guys are awesome.
Thank you. Great
Great
information.
call. Thank you, everybody.
We can stop the recording.